Challenges in Nursing, Nosocomial Infections by Megan Moody and Tanner Bernard. The definition of a nosocomial infection is any infection is caused by the colonization of an unwanted microbe in the body that creates an immune response. But nosocomial infections are infections that are acquired from a healthcare facility, which means the patient did not arrive at the hospital with this certain infection, but sometime during their stay in the hospital they obtained this infection. On the right is a picture of the chain of infection. Infections are caused by microbes such as bacteria, fungi, parasites, or viruses, which are introduced to a reservoir, which could be human beings, animate, inanimate objects, and they exit the reservoir through the blood or intestinal tract, respiratory tract, skin, or mucous membranes, and they can either be transmitted through the air or direct contact or by vectors, and then they enter a new reservoir through the blood, intestinal tract, mucous membrane, non-intact skin, or the respiratory tract. And the new host could be an elderly person, someone who is immunosuppressed or has chronic illnesses, and that is how infections are spread. The World Health Organization says the four most common nosocomial infections are urinary tract infections, surgical wound infections, pneumonia, and primary bloodstream infections. Each of these is associated with an invasive medical device or invasive procedures. Numbers do not lie. The nationwide nosocomial infection rate among the 6,449 acute care U.S. hospitals in 1975 to 1976 was 5.7 nosocomial infections per 100 admissions, and that over 2 million nosocomial infections occurred in a 12-month period in these hospitals. Nosocomial urinary tract infections constituted 42% of the infections, surgical wound infections 24%, nosocomial pneumonia 10%, nosocomial bacteremia 5%, and nosocomial infections at all other sites 19%. Nosocomial infections are detrimental. If an immunosuppressed patient, such as a cancer patient, were to acquire a secondary infection while in the hospital, this patient could suffer severe consequences from a preventable infection, such as death. Nosocomial infections are very expensive. A patient may come to the hospital for a minor procedure that costs under $1,000, which health insurance covers most of the cost anyways. But if a patient acquires an infection while in the hospital, health insurance may or may not pay for the extra days spent in the hospital. Not to mention, hospitals may have to pay out of pocket for some nosocomial infections. Ways patients can acquire a nosocomial infection? There are several ways a patient may contract an infection in the hospital. Think about it. There are hundreds of sick people in a hospital, and microorganisms can easily be transferred from one patient to another via animate or inanimate objects. Objects that move from one patient's room to another, nurses or other medical staff's hands, stethoscopes, or medical equipment such as blood pressure cuffs. How are nosocomial infections a nursing challenge? Nosocomial infections are a challenge because nurses have several barriers they have to overcome in order to prevent infections from occurring. Barrier number 1, keeping a clean environment. Nurses' skills are challenged every day they are in the hospital to maintain a clean environment in order to prevent nosocomial infections from occurring. Barrier number 2, life supersedes cleanliness. Sometimes nurses are rushed into emergency procedures where maintaining the life of their patient is the number one goal, and preventing the spread of microorganisms is put on the back burner. Barrier number 3, overwhelming nursing shifts. Nurses also work busy shifts, and sometimes they may have up to 6 patients. At some point, the nurse may be in such a big rush to get a task done that washing their hands or wearing gloves may get skipped. Barrier number 4, microorganisms are not visible with the naked eye. So the only way a nurse would know if a patient had an infectious microbe in their system would be if the patient was showing signs or symptoms of infection. The picture on the right shows the amount of microbes living on the human body. For example, in the nostrils, there's Corynebacteria, there's also Propionibacteria, and other Actinobacteria. Bacteria are all over the body, in between the fingers, on your skin, and your ear opening. So, avoiding bacteria is very hard. Barrier number 5. Microbes are looked over by nurses if there's no signs or symptoms present. Certain microbes live on or in people as their natural flora. One patient with naturally living MRSA in the nostrils may be asymptomatic of infection because of immunity. But if a nurse overlooks washing her hands after patient contact, the nurse could potentially spread MRSA to the next patient down the hall who is not immune, which could cause a serious nosocomial infection. Barrier number 6. Immunosuppressed or susceptible hosts make prevention 100 times harder. Sometimes it is nearly impossible to prevent microorganisms from entering a susceptible host. Patients who have undergone surgery and who have impaired tissue integrity are very vulnerable to infection. This is a very difficult challenge in nursing. Nurses need to be better trained on how to deal with open wounds and how to prevent microbes from infesting the tissues. Barrier number 7. Long hair don't care. Hospital staff are constantly breaking the rules when it comes to personal hygiene. Women wear false nails or keep their nails long. Men still grow long, scruffy beards. Women do not keep their hair short or pinned back. These are all issues and easy ways to transmit infections. Please note the picture on the right of the man's beard. It has several debris which could be transmitted easily to a patient. Ways to overcome nosocomial infections. Yearly recertification. Sometimes nurses may need to be refreshed on how to perform sterile procedures. It may be that some nurses think they are maintaining a sterile field correctly, but they actually are not. Overcoming the challenge. Nurses should work hard at maintaining a clean hospital room for their patient. This makes sense considering patients spend the most time in their rooms. Patients' bed linens and gowns should frequently be changed. How to overcome barriers. Thorough risk assessments should be obtained in order to classify patients who may be minimally or highly susceptible to infection. For example, a patient who is not immunosuppressed and is not undergoing any surgical procedure is minimally at risk for infection. On the other hand, a patient who has suffered from trauma or severe burns and who has had an invasive procedure would be considered high risk for infection. Hospital policies would facilitate the prevention of nosocomial infections. Policies should be intact for proper ways to clean the hospital environment. Sweeping and dusting should not occur where susceptible hosts reside. Frequent cleaning of blood pressure cuffs or other hospital equipment with disinfectants should occur to minimize cross-contamination between patients. Dress codes should be enforced. Hospital staff should be written up if they are seen with long fingernails, long hair, long facial hair, or their improper uniforms. All of these things are perfect for microorganisms to be transported in. Therefore, they should be maintained for safety of the staff and the patients being taken care of. Nurses should be reaccredited for their catheterization skills. By maintaining aseptic technique and wearing sterile gloves, patients' risk of infection is reduced tremendously. Also, by limiting the duration of catheterization and keeping a closed drainage system will also decrease the infection rate. Clean operation rooms should be used for surgical procedures. The OR should be disinfected before an operation, after an operation, between operations, or once a week if the room is not being used. All staff involved in an invasive surgery should be thoroughly observed. Surveillance of the procedure will help in prevention of cross-contamination. Some patients may need to be isolated. Patients with airborne illnesses need their own room, and anybody entering or leaving their room should wear a mask. Patients with antimicrobial resistant infections should be taken care of by using personal protective equipment. all patients should be screened for any type of resistant infections on admission. By doing this, nosocomial infections may be reduced. Bottom line is, patients come to the hospital to be treated, not to gain new infections. If all medical staff abide by the rules, then nosocomial infections will be prevented effectively. The World Health Organization provided me with all the information to teach everybody about nosocomial infections. And thank you for watching.